What the actual... job? Hello, and welcome back to What the Actual Job, where I interview people about their careers so high school students can gain a better understanding of the jobs they'd like to pursue in the future. Today's interview is with Erin Laporte, a nurse from the Ottawa Hospital.
So my name is Erin Laporte, and I am a registered nurse on the neurosurgery unit at the Civic Hospital. And I've been doing that for same unit for over 20 years.
Oh, wow.
Yeah.
Have you enjoyed it a lot?
I do. I think I really discovered that I enjoy surgical patients.
Yeah.
Looking after them after surgery, and I enjoy my coworkers too. That's a big part of your day, right?
Yeah.
Is interacting with them. So that's kind of what's kept me there. Yeah.
Nice. So what does a typical day look like for you?
So my typical day, I would kind of arrive. Usually I'm there about 30 minutes early, and I'll start looking through my patient files just to kind of get to know them. So on day shift, you'll have 4 patients, and then on night shift, you'll have like 6 or 7. So I'll just review, their medications, their last blood work, kind of, if they had surgery, what date they had their surgery, if there's any tasks that I need to do for the day, kind of how they mobilize and that kind of thing. And then I will get report from the nurse from the previous shift. And then after that, I'll just kind of go in and see each patient, and I will conduct a head-to-toe assessment. Usually then it'll be, time for medications, blood sugar checks, that kind of thing. And then kind of depends, during the day, there'll be a lot of going on, getting people bathed and up and mobilizing if they have, any tests, kind of getting them ready for that.
Yeah.
At nighttime, it's a bit different, and then it'll be just kind of, any tasks that I have throughout the shift or medications and that kind of thing. During the day, there's a lot more kind of going on as well. During the day, around 11 o'clock, we have interdisciplinary rounds where the nurses and the doctors and all the members of the team kind of gather and discuss kind of how the patient's doing, and kind of getting them teed up for discharge, or if there's any kind of barriers to discharge.
What would you say you like most about your job, and what makes you want to come to work every day?
Probably twofold. What I like best about my job is interacting with patients, getting to meet them and their families, and kind of being there for them, during probably some of their darkest days. A lot of times they're afraid. We have a lot of oncology patients, sometimes young patients with new cancer diagnosis, and they're just really scared.
Yeah.
And just to try to provide them some comfort, reassurance, and just being kind of, being there to support them. That's probably my favorite part. And also, again, just, hanging out with my coworkers, working together as a team. I really enjoy them. There's many of them that I've worked with for many, many years. And, we kind of just joke around and have fun.
Yeah.
And sometimes it's a tough environment to work in. It's not always a happy time, but we try to kind of make the best of it.
Nice. And then on the opposite side, what's the most challenging or hardest part about being a nurse?
I would say, there's a couple things. I would say a lot of the time is dealing with the lack of resources, constraints in our healthcare system, as I'm sure you're aware of. And, sometimes even just basic supplies to do your job, things like lack of commode chairs or shower chairs for patients, missing supplies and trying to figure out even dressing supplies, and it just being kind of this big ordeal to get them ordered, and lots of obstacles. That's part of it. And then sometimes dealing with staffing shortages as well, and having to pick up extra patients, and sometimes it adds a lot of stress to your day, and sometimes it's not always necessarily safe or ideal, right? So it just adds a lot of stress. That's probably part of it.
So what would you say is the most valuable or significant thing you've learned from your career so far?
Ooh, that's a good question. I think part of it is like the importance of empathy and
Yeah.
not allowing your, being busy or stressors in the workforce impact negatively the way you interact with a patient. Because, like I said, it's a lot of times a very stressful time for them too.
Yeah.
And sometimes, I just kind of being mindful of like my mood and kind of the way I interact with a patient. It's, it's not their fault.
Yeah.
That we're dealing with all these shortages and things like that, and trying to kind of just not rush them, just trying to be very mindful of that.
Yeah, that's a really good lesson.
It's not always easy, but I try.
Yeah. I think the effort is like where it really counts too.
I agree.
Yeah. For you, what was the education you took to become a nurse?
I did the Bachelor of Science of Nursing from the University of Ottawa, so it's a
nice.
4-year honors program. And that's kind of the route that I feel like most people take.
Yeah. Was it hard to do? Like, was it an intense program?
It was uniquely challenging in the sense that, a lot of degree programs, you kind of go to class, you write your papers, you do your exams, and you maybe some research, you go home. With nursing is unique that you're also doing like a lot of like practical with like shifts in the hospital and that kind of thing. So it was kind of busy in its own sense. Like sometimes we would be doing clinicals in the hospital till like 11 o'clock at night, have class early the next morning, and that kind of thing. So I think in terms of, the schedule, it was a bit grueling. And I mean, some of the courses were heavier, like some of the pathophysiology courses, a lot of like, I remember for me, like the cardiac anatomy was really hard.
Yeah.
But it's definitely doable. It's very balanced between kind of the science and the social science, which is kind of neat. It's just this big, the fitting in those clinicals, I think, was what made it challenging, but it's very doable. Yeah.
Would you say that the clinicals and working at the hospital like really prepared you for like a career in nursing?
I think it helps for sure. Like any sort of healthcare job, the clinicals are great, but I also think really getting like a part-time job, like I worked with like a healthcare aid in a retirement home and that kind of thing, you're really getting a real sense of what it's actually like. Like I think the university sometimes shelters these students, probably for liability reasons, from like, the way it really is, and then but you don't have that kind of sheltering when you're there as an employee, right? So it did and it didn't. So
interesting. Is your career what you thought it'd be when you started, and are there any expectations that turned out different from reality?
I would say it's pretty much what I expected. I think, like I said, I had worked in healthcare a little bit through nursing school, and so I had kind of seen, the realities of like the lack of funds and that kind of thing. And so I don't think it's that different really than what I had expected, to be honest. It's pretty much what I expected. I would say in the last couple of years, like since COVID, it's been a bit more challenging. I think I've noticed as a whole, like society's gotten a little bit more, I don't know whether it's fearful, frustrated or whatnot, but in the last few years dealing with kind of the frustration sometimes of like family members and things like that has become more challenging. And I don't think I really expected that, but otherwise I would say it's pretty much in line with what I expected,
Interesting. So how do you is it a surgical nurse?
Yeah, neurosurgical nurse,
How do you as a neurosurgical nurse make a memorable impact?
I think for me, just continuing to like really empathize with people and kind of treat patients, especially the way, like I'm mindful of how I would want to be treated if I were in that same situation. So I've had, like obviously a few patients over the years that like I'll never ever forget. And, I remember we had a very young patient that had this catastrophic brain injury, and she was similar age. Actually, my daughter's the same age as you. She's a grade 12.
Oh, wow.
So, yeah. That's why I agreed to do this. I was like, somebody to help her too. And I had basically said to her, even though I wasn't sure what she was going to understand or comprehend, that she, like it or not, she had another mom for the shift. And, we weren't sure how well she was going to do, but she was very young, and she actually came back to us.
Oh, nice.
Like, keep in mind, she was like nonverbal and,
Yeah.
requiring like a mechanical lift to stand up and things like that. She came back walking
Oh,
to the
wow.
nursing station, and I gave her like the biggest hug. She's back in university courses and everything.
Oh,
like,
nice.
it's incredible. So there's been a few patients that I will kind of carry with me forever, and again, I think it's just like continuing to kind of empathize with them.
Yeah.
Sometimes I think maybe too much. It's probably my detriment. Yeah, I think that's part of having a memorable impact on them, is just remembering to treat them with kindness and empathy.
Yeah. Yeah. And like being in the position of the patients you have, I imagine that empathy and, treating others like you'd want to be treated is very impactful,
I
and
think so.
very helpful in those situations and scenarios.
Yeah, I agree. I think so too. Just kind of not losing that focus.
Yeah.
Sometimes it's so easy to kind of get caught up in your day, but I have to kind of just stop and like take a minute and just, really think about what's important here.
So for you, what would make an excellent nurse, and what advice do you have to people wanting to go into nursing?
What would make an excellent nurse? So I trained a lot of nurses, so I've given this some thought. I think there's a lot of things. Empathy is like, I think, number one.
Yeah.
If your heart's not in the right place, you're doing it for the wrong reasons, you're going to be terrible at it.
Yeah.
I think, empathy. I think excellent time management and prioritizing skills are important, and critical thinking and judgment. And also being kind of humble enough to know what you don't know, and being able to be comfortable enough to ask questions, because, even after all these years, I still sometimes second guess myself, and I'll, collaborate with my colleagues. So I think that those are very important. You also have to be very hardworking. It's a hard, busy job.
Yeah.
Yeah. My advice is make sure your heart's in the right place. I think it's an excellent, very rewarding career. If you really have to want it, because it's not easy. It's not glamorous. The hours are terrible sometimes.
Yeah.
But I love it. So I would not discourage anybody from doing it.
That's great. I like the humble point you talked about of it's okay to not know things sometimes, and to ask questions and get some help. That's
absolutely.
Yeah.
I think that's so important, and I think too, like, everybody brings something to the table. Like, okay, I've been a nurse for 20 years, but some of the younger ones have, the policies changed for me, these hospital policies, and then younger nurses have one policy, and they know the most current ones, and sometimes they'll ask them, or technology or something. So like, if you don't know something, don't feel bad. Odds are you bring something to the table.
Yeah. I really like that perspective. And then we have a few questions from students. What made you choose nursing over other healthcare careers?
So if I'm being completely honest, it was my second choice.
Oh, wow.
So actually, I really wanted to be a dietitian. That was my first choice. But at the time, and I don't know if this has changed, but at the time there was no programs in Ottawa. And so I thought, well, I'll take nursing. If I don't like it, I can do a master's in something else.
Yeah.
And so I kind of jumped into it, and I did end up really enjoying it. So it kind of all worked out in the end. But that's, kind of a second choice, really. It wasn't my first choice.
That's interesting. Would you want to explore like a dietitian career now or in the future, or you set on nursing?
No, I think I'm okay with nursing, but I'm actually planning on going back to school to
nice.
become a nurse educator. Yeah.
Nice.
So I'm gonna. I really enjoy teaching, and so and I still want to stay in nursing. It's just, I'm getting older in my back and everything, so I think it's physically a bit easier for me, but I definitely want to stay in nursing. And no, I wouldn't go to dietitian school. I don't want to change that. I'm very happy where things are.
That's great.
Yeah.
Are there any holidays or times of year that are busiest?
So I would say for my population in particular, winter. So we deal with a lot of falls. We deal with a lot of falls resulting in brain bleeds. So we have a lot of our patients, elderly patients, are on like baby aspirin are on anticoagulants for cardiac reasons.
Yeah.
And what happens is they'll fall on the ice, and then they'll end up with what we call a subdural hematoma, so a bleed into the brain.
Oh.
And we see a lot of that in the winter with the ice.
Interesting. I was not expecting the winter of all times to actually be.
Yeah, winter falls in the elderly, number one for sure.
Yeah. And as a nurse, do you find it difficult to watch shows like Grey's Anatomy?
Yes.
Yeah.
My husband won't watch them with me because I'm picking the plots away. They would never do this in real life. They would do that. The Pit is very good. The Pit is spot on.
Oh.
But most of the shows I can't watch them. People can't watch them with me because we're just picking apart about how unrealistic things are.
Yeah, I would imagine. What's The Pit about?
The Pit, so it's really good. It's about an emergency room team, and Noah Wiley's in it. I think it's on Netflix.
Okay.
It's only done one season. It's excellent.
Oh, that's nice.
Because it's very, very accurate. And that's kind of what they're known for, is being the most medically accurate. So it's very good. I recommend it. It's a good watch.
Do you have any last comments or anything you'd like to finish with?
Well, just that I would, encourage anybody that's interested in healthcare to check it out. It's pretty much a guaranteed job. You can enjoy traveling. You can take it with you. It's a very, transferable skills and job you can do really anywhere. You can get a job anywhere you want. And so don't be afraid of nursing. It's a great, great career, especially if your heart's in the right place.
Thank you again to Erin Laporte for the amazing interview about a career in nursing. If you want to listen to this episode or others like it, you can listen here on CKCU 93.1 FM or wherever you listen to podcasts.